welcome to another episode of Simply Healed. And once again, we have Dr. Jansen, Calalan with us here this evening. Hi, Doc.
Hello, Shine. Hello, everyone. Happy to be here.
Happy to be here. Today's topic is about cervical cancer because the last few episodes, especially during the Q&A, there have been many questions coming from the audience and they are cervical cases. So Doc, today we're going to talk about pap smear. It's good that you're a doctor because we are both guys and we are talking about pap smear, all right? So first of all, Doc, why is it important to detect cervical cancer? And what does it mean to have cervical cancer? How dangerous is it? What's its mortality rate?
The reason why we want women to undergo regular pap smear tests is because cervical cancer actually is one of the cancers which has a very high mortality rate. So if we take an average from early stage, stage 1 cervical cancer up to stage 4 cervical cancer, the average mortality rate is 66%. So meaning 66 out of 100 women who get cervical cancer on average dies.
Wow.
Okay.
And even with successful treatment, even if you have a complete hysterectomy, the recurrence rate for cervical cancer is also very high. Right?
Yeah, it's also very high. It's at 22.3%. So approximately 1 out of 5 women will have recurrence.
Wow.
Okay. If we are able to detect cervical cancer very early on, so how much is the survival rate? It's actually, the 5-year survival rate is actually 92%.
That's a huge difference from 66% dying versus 92% surviving.
Yes,
day and night difference.
Yes, just because you detected it early.
Now, the question with the challenge with all cancer is it's very difficult to detect cancer early. In fact, most people who do detect cancer early is by a stroke of a blessing that they went in for something else and they found the tumor. But for cervical cancer and for pap smear specifically, how effective is it in catching cervical cancer early?
Yeah, actually, it has a very high specificity and sensitivity rates.
So you can even catch it in stage 1, stage 2?
Yes, even in stage 0, we have
even in stage 0. Wow.
We have such a thing as a stage 0 cervical cancer.
Okay, if you ever find a stage 0 cervical cancer, it's like praise God, you probably dodge a bullet because you can definitely treat yourself.
Correct.
Probably 100% cancer
and
success rate.
Also, this is one of the good news. If you detect a cervical cancer early on, patients who have cervical cancer stage 0 just needs excision biopsy. Excision biopsy is just removing that area of the cervix which is which has the cancer.
Oh, so it's a very minor.
It's a very minor procedure.
Almost like burning off warts, like that,
exactly.
right? Yeah.
And you don't even need chemotherapy or radiation therapy for that matter.
Wow.
Okay, so that's how important early detection is, because you can really literally dodge a bullet.
You can dodge a bullet, right? Because if you don't detect it and you do have cervical cancer, then it's almost like a greater than 50 chance death sentence. But if you do detect it early, it's almost 100% cure rate and you dodge a bullet.
Yeah.
So what is pap smear? Just for the guys who are watching and maybe for the women who have not actually done any pap smear in their life.
Okay, so a pap smear test. So what is the goal of a pap smear test? It's actually to get cells from the cervix.
Okay.
So take a look at this image. Okay, so doctors usually, how does a pap smear procedure begins? Okay, so a patient, a woman, lies on her back in the lithotomy position. So this is what a lithotomy position is.
Wow, we are learning medical terms again.
Now, so I know we have another term for this kind of position, but I'm not gonna mention it.
Okay.
So we stay medical. Okay? So this is how a pap smear procedure is being done. Okay. So now the woman is in this position. Okay. Now we need to open up the vagina. So the doctor inserts a speculum to open it up. Now once the doctor opens the vagina up, the doctor will now try to visualize the cervix. So the cervix is a donut-shaped object. Okay. So take a look at this image again. So this is what the cervix looks like.
Oh, that's interesting.
So the doctor would have to be able to visualize this part. Okay, after the doctor visualizes it, the doctor now gets a brush and swabs the area, the middle part, okay?
Oh,
The
okay.
middle of the,
The
donut.
center of the
center
donut.
of the donut. So that is where usually, cervical cancer or cervical cancer cells are.
Here.
So the doctor gets a sample, then the doctor now sends the sample
For
to the
test.
laboratory for testing. So we actually have a number of ways on to detect cervical cancers. So one is pap smear and another one is HPV testing. Okay, you can actually opt to do pap smear alone, HPV testing alone, or both. Okay,
Which between HPV testing and pap smear, which is the one that is better at detecting the cancer?
Actually it would be the HPV test.
Oh, okay. That would be
That would be the more accurate one.
all right.
However, it would be more prudent for you to undergo both.
Okay.
Yeah, okay, because sometimes, tests are imperfect. Okay, so it would be better for you to undergo both so that you can, the test results would be more accurate.
The difference between a pap smear and an HPV test. How do you do a HPV test then?
HPV testing is just, running the samples in a PCR test.
Oh, so it's still the same procedure of getting the
Getting the
samples. You
sample.
still have to be in that position. They still have to swab
To
your
swab.
donut.
Yes.
Oh, so
Yeah.
mine as well. You've already done the
Might as well,
procedure.
okay.
Mine as well. It's,
Mhm.
it's not okay. That makes sense. Doc, just for many viewers who have never done this before, what would the average cost be of having a pap smear?
The pap smear test is so cheap. I think it's around 150 to 200 pesos.
Okay, that is for US. But sorry, it's not.
Peso,
Yeah.
Philippine value.
Yeah, for 400. Did you say 400 pesos?
150 to 200.
Okay, that
Around
is
that range.
like less than $4, right? So that is really no reason why. I'm gonna tell my wife this because I've been here with her the last 2 years in pandemic, so I'm very clear her schedule the last 2 years. She has not done a pap smear, so I think we'll go and get it done. Doc, there's also right now even DIY pap smears.
Yes.
So, but hearing from you about the procedure, I would guess that going to a doctor would still be better because how do you aim for the center of the donut?
Exactly. So I've seen these DIY pap tests, in a lot of e-commerce platforms.
Okay.
Now my stand on this is that
Not that it doesn't work, but it might if you are doing it yourself, you might miss. You might
miss
you might
exactly
miss.
because even healthcare professionals, the cervix, if you are not experienced, okay, if you are just you are doing it the
A
first
novice.
time.
Yeah.
I mean, novices, medical students, medical interns,
Even medical students.
even medical interns, medical students have difficulty visualizing the cervix.
Okay.
Okay, so if you are someone, a lay people who have no medical training whatsoever, and you are doing it blindly, guess what? Most likely you will miss it. Okay.
So back to why we want to do all these pap smears to maybe even catch your cervical cancer at stage 0. So I think to catch your cervical cancer at stage 1, 2, or 0, you probably have to be very accurate because your cancer is so small. Of course, if your cancer is late stage, it's already more. It's not just a small
yeah,
area. So a DIY will work.
would make
But that
sense.
defeats the purpose of why you want to do a pap
Yes,
smear.
yes.
Catch it really early. So why don't you schedule? So now we know it's good to go and schedule with a doctor to do a pap smear. Doc, how often should a woman schedule herself for pap smears?
Okay, so how often is it? We have to divide this into two age groups. Okay?
Alright.
So the first age group would be So at what age would it be? At what age would it be? At the earliest that you should undergo pap smear test. It's at age 21 years old.
21.
So 21 years old until 29 years old,
Okay.
women should undergo pap test every 3 years.
So those under 30 every 3 years. Oh, easy to remember. 33.
Yes.
Yeah. Okay.
So HPV testing alone can be considered for women who are aged 25 to 29.
But the pap tests are
still-
still preferred.
Yes, pap tests are still preferred. Now, for women age 30 to 65 years, no, we have 3 options for testing. So, number 1 is pap test and an HPV test. So, co-testing every 5 years.
Okay.
So, remember that. If you go for pap test and HPV testing, that would be every 5 years. Okay? If you are going for pap smear test alone, that would be every 3 years.
Which tells us like what you said, the HPV test would be more accurate.
Yes.
That's why HPV test
it's longer.
is 5 years.
Okay. So also, if you are very uncomfortable to undergo pap test, HPV testing, if you're doing HPV testing alone, that would be every 5 years as well. Okay.
But Doc, as you mentioned, right, the collecting of the samples is one procedure. The pap smear test and the HPV is actually the laboratories doing it. So if you've gone already if you already collected the sample, there's no point. Don't save that $10-20, right? Just go and do it both, right? Now after you've started yourself on a schedule of testing every 3 years or every 5 years, when do you stop? Or is this a lifelong process all the way?
Okay. So of course at some point you have to stop screening. Okay, so the age where we stop screening is at age 65 years. Okay, but we have to fulfill a number of criteria. So number 1 would be if you do not have a history of moderate or severe abnormal cervical cells or cervical cancer, and if you have had either 3 negative pap test results in a row, 2 negative HPV tests in a row, or 2 negative co-tests result in a row within the past 10 years, and the most recent test should have been performed within the past or 5 years, no? Depending on the type of test. Okay, so if you fulfill everything, then you can stop undergoing pap tests already.
So if you are age over 65, your last pap smear or HPV test should be in the last 3 or 5 years. And it should be a consecutive one. So if you never ever took pap smear test and you took one when you were 62 and now you are 66, you only fulfill one criteria. You have to go for one more because you need a consecutive negative. All right?
Correct.
Yeah. So it's like you do one test, they just want to make sure it's not a fluke or mistake. So do 2 consecutive ones, and you're after 65, you are free. What about post-hysterectomy? What about those who do have cancer?
Now, for post-hysterectomy, so hysterectomy is actually the removal of the uterus. And if you are going to remove the uterus, the cervix goes along with it.
Okay.
So now, the question would be, I don't have a cervix.
Yeah, you don't have a
anymore.
cervix, so how do you test?
Should I still go for the pap tests? Okay. So if you have had a history of cervical cancer or high-grade cervical cell changes, okay, you should still continue to have screening for 20 years after the time of your surgery. Otherwise, you don't have to undergo for pap smear anymore.
So how do they test if there's no more cervix?
Yeah, they swab the cervical stump.
Oh, you still swab what is left over.
Yes.
All right. Okay. So there you go, Doc. Just to clear all the doubts and loose ends, 3 last questions. Why do we not test for cervical cancer before age 21? Why do we not test it annually, like every year? And is cervical cancer screening even required if I'm not having sex? For example, some ladies who have abstained from sex, either by age or by choice.
Yeah. So to answer the first question, why don't we test for cervical cancer before age 21? It's because cervical cancer cells at this age group, no, prior to 21 years, is very rare. And even if the women in this age group develop cervical, get cervical cancer cells, these cervical cancer cells, the immune system can fight off, and they turn normal anyway. Okay. So at this age group, you don't have to worry. Again, how does the body fight the cervical cancer off? Integrity of the immune system. Number 2, okay, inflammation. Okay, because HPV when you get infected with HPV, for
Yes.
those
Who are sexually
teenagers
active.
who are sexually active, the body can still, fight off the inflammation and prevent the cervical cancer cells from developing.
From developing.
Okay, so at this age group, no need for
So it's
for
good to be
testing.
young.
Yes,
It's good
to
to
be
be
young. However, once you step at or on age 21 years, then you have to begin testing already.
Now, the second question, why not yearly?
Why not yearly? It's because cervical cancer will not happen at least within the next 3 years.
Also, is
Okay.
the rate of growth of the cancer.
Yes, it's the rate of growth of the cancer. Now, this is across age groups, no, from 21 to 65 years. Okay, so and even if you do test annually, right, there will be false positive results that lead to a lot of tests, a lot of unnecessary tests. So that would bring up costs, that would bring you worries,
Stress
and,
you.
stress you unneeded at that. Okay, so no need for annual pap testing. Okay.
Doc, since we are on this topic, I think it'll be interesting for us to do another talk on simply the topic of the doubling time of cancer.
Yeah,
You
that
know,
would be wonderful.
that would be
Yes,
interesting,
that's
right?
interesting.
Like, why do your cancer cells suddenly from 4 centimeters become 8 centimeters, but for the last 6 years it was so small that it was not detected? I think that would be interesting for many people, especially cancer patients. And last question before we end, and I can see there are already questions coming in from our audience, and some of them are related not only to cervical cancer. Okay, the last one is, why is cervical cancer screening recommended even if I'm not having sex?
Okay, so to answer this, we have to understand how you get HPV and what are the factors that can increase your cervical cells risk of becoming cancerous. Okay, so number one, how do you get HPV virus in the first place? It's through sexual intercourse. However, if you are not engaging in penetrative sex, then orally it can also be transferred.
Oh, okay.
Contact, it can also be transferred through contact. Although it's extremely rare, however, it can still happen.
It can still happen.
Okay. Now, of course, for the other risk factors, what are the lifestyle behaviors that can increase cervical cancer? What are the lifestyle behaviors that can increase the risk of cervical cancer infected with HPV to become cervical cancer cells? Okay. So that would be your smoking and being infected with HIV.
Where your immune system is compromised.
Yes, that is when your immune system is compromised already.
So smoking is usually associated with lung cancer and actually basically sets up your body in a negative state with inflammation and all that. But specifically, it actually raises your risk of developing cervical cancer from your HPV infection. So another reason for us not to smoke. Doc, again, one last question, which I almost forgot to add, which is so obvious also. You always talked about getting vaccinated for cervical cancer. So there is HPV vaccination. If you are vaccinated, do you still need to go for all these testing?
My stand on this is yes. Okay, so why is it so? Because getting vaccinated with the HPV vaccine, okay, you only get immune against the strains that are contained in the HPV vaccine. The good news here is the manufacturers, the scientists, the researchers that create the HPV vaccine, the strains that they put in there are the most common HPV strains that causes cervical cancer. So if you receive HPV vaccine, okay, at least 90% or at least 95% you would already be immune against cervical cancer. However, the remaining percentage, okay, you can still get it from other HPV strains, rarer HPV strains, or if the HPV virus mutates, then in the chances that you are not immune against that mutated strain or that other strain, then you can still develop cervical cancer. So it would still be better to do screening.
I mean, it's just like if you got COVID vaccine, doesn't mean that when you're having a flu or whatever, you don't test yourself for COVID, right?
Yes.
Because there's still a chance that you might have actually caught it. And again, the reason is if you catch your cervical cancer in the early stages, it's just like an inconvenience because you can actually just treat it and it will go away. You literally dodge a bullet, save your life. So there's no reason not to.
Yes.
And in short, Doc, having a yearly annual medical checkup is a good habit.
Yes.
Because on every 5 years, you include the pap smear in your medical checkup. But it's like a regular thing. You don't feel it's a hassle. You don't forget. So doing an annual checkup is a good idea.
Yeah, it is. However, please don't get the wrong idea, okay? Having an annual checkup is, we may think it, proactive because we are doing annual checkups. However, that is not active enough. Okay, that is not proactive enough.
Wow, I'm glad you say this because I think some people will say, "Oh, my annual medical checkup is clear. I can continue with my life as it is."
That's what I mean.
Oh, that's what you mean.
That's what I mean, okay? Because if you are just undergoing the annual checkups, the annual screening, then you are just looking. You're not doing anything to prevent it from happening in the first place. Okay, so what are the things that you need to do to prevent it from happening? So stop engaging from promiscuous activities, sexual activities. Okay, so that's number one to prevent cervical cancer. Number two, always eat a predominantly plant-based diet. Okay. And number three, if it's so difficult for you to eat a predominantly plant-based diet, there are supplements like Simply Nature Pea Bars, which is made out of a very special strain of microalgae that can help boost up your immune system to fight these infections that causes cancer, right? Yes. Because studies have already shown that. Why am I so always recommending this? Because Simply Nature Pea Bars, they have tested their products against the immune system and saw its effect on the immune system, and they've shown that dendritic cells, which are scouts that gets all the infectious diseases.
Not just cancer. All infectious diseases.
So dendritic cells are antigen presenting cells. So the main job of these cells is to detect infection, detect cancer cells, and present them to the immune system so that the immune system can go and kill them off. Okay.
And of course, when I first met Doc Jansen, wow, how many years is it now? 4 or 5 years?
4 or 5 years.
Yes, and in that in between time, so many patients. So there's a difference between the theoretical knowledge and now when I talk to Doc Jansen and when we discuss about EPA protocols, his confidence level and comfort is so different because once we see it in actual patients, and your own patients, it's a very big difference. So without further ado, Doc, let's move to the Ask Me Anything segment.